take a seat for a while. So it's going. And are you able to see from here? Just go to the homepage. This one. Then you can hang the link that I will be populated to send by your WhatsApp. Is that this or share it here on WhatsApp? Yes, you can send. I sent to our big group over there this one. Yeah, and then every week all the. Yeah, so we can start. Yeah. So we're here. Okay, so thank you so much for coming in. We have some virtual audience here. Yeah, thank you so much. So just a little bit about our clinic ourselves. So this clinic is a chiropractic clinic. So we're specializing in chiropractic, sports massage, spinal decompression, joint repair. So everything around pain management. I am Dr. Jenny, and it's Dr. Jeff, who's senior patient inside. So we, it's from the experience-wise, both of us has been using this field about 10 plus years. The clinic has been here about 9 years. Okay, so in here we offer various different services. I'm just gonna share you a little bit more about that. Okay, so how we develop. Go come and say that. Yeah. Come. Yeah. Hello. Hello, hello. You want to say over there? Yeah, hello, hello. Yeah. So we have a quite different way of approach to pain management and what kind of solution we use is we try to approach from more holistic. So when it comes to joint, like spine, joint of your elbow, your knee, your ankle, everything like that, we try to approach it from the chiropractic perspective, which is increased joint mobility. But when it comes to spinal disc, so the spinal disc is basically the disc between the spine. For this kind of problems, we'll utilize like spinal decompression tables, which is the spinal decompression tables right here, so we reduce the pressure of the disc, rehydrate this to the disc health. And when it comes to muscle and tension relief, we have things like dry needling and sports massage. So basically is we look at a human body and see what kind of problem we have, and we try to use more specific treatment to treat patients so we can improve better. The more targeted way we are treating. So why we telling you guys all these is that just kind of what we're going to share about today is really based on the 10 plus years of experience we have in treating patients and what we see can be a better way or vehicle to help our patients to improve. So we just want to share that today in today's workshop. So very happy you guys managed to attend. Otherwise, I'll just talking to the virtual audience. Okay. Okay, some information shortcut here is as the technology improving our life, in a way it also make our life a bit easier. So this is a stat from health promotion boards in Singapore. About 80% of Singaporeans will experience low back pain at one point in their life. Okay. So what is causing the low back pain? So 77% of them are usually having this kind of problem from these three main habits. So this again is according to the Singapore Health Promotion Board. And either they are twisting or bending. You know, sometimes patient could be saying, "Oh, I was just picking up something, then all of a sudden, like I cannot move anymore." Or awkward position, like we are spending more time sitting in front of computers, so sedentary lifestyle doesn't really help with our joints. And also lifting heavy things, big back postures, carrying children or just carrying groceries. Okay, but so how do we solve these problems? There's many ways because of the problems. Some people would be saying like, okay, maybe I will do some exercise to strengthen my core, or maybe some supplement because maybe my joints also good, maybe sometimes some meditation can make it better, or maybe I should rest a bit better, maybe bed rest for like 6 to 10 days, maybe will solve the problems. But actually, all these is not really addressing a cultural issues like why these things happen to our body. So let's say if our body is quite strong, has good integrity, then shouldn't be resilient enough to not have this problem coming. So what's the core issue with this? Okay. So this is something is come to our understanding in the 10 plus year experience we've been doing is, first of all, we have all these issues is because a lot of people don't really understand the nature and the physiological human body, which is the spine. So when the baby was born, no baby was born was able to like stand and walk the moment that you're there, right? So you usually for 6 months they kind of like lay on their bed, pretty much laying flat until around 6 month time they're able to turn. Maybe around like 8 to 9 months they're able to crawl. So why there is this like gradual developmental process is because this is how human body was evolved is when the baby is born, the spine is like very, very soft. In fact, it's quite flexible for a lot of reasons. Because you are in the womb about 8-10 months time, it's very hard for you to move around if this is very rigid. So this is very flexible. So when the baby is born, they need some time to get the spine a bit stronger. So why they're able to learn to crawl first, but rather than stand, is when they start to crawl, they tend to lift their heads up. This is a natural process we all have because we need to see where we're going, right? We cannot just like looking down at them. So when we start to look up, that's where the neck curvature starts to develop. So there will be another C curvature in the neck. So that's the first curvature that starts to develop. Then maybe around about 10 to 11 months, they will start to able to pull themselves up, maybe like holding things, moving around. When they pull themselves up, is the back curvature starts to develop. So a healthy spine usually have a curvature in the neck and curvature in the back. So you form this like as natural curvatures. So these, why we need this curvature is whenever there's a curvature, if there's any compression, shock, running, walking around, the curvatures can absorb all these. So our spine can last a lifetime. But if it's very strict, all the pressure comes in will go directly to the joint. So wear and tear a lot faster, so the lifespan of the spine will come a lot less. So now, how is this related to our lifestyle? Is because we're spending so much time with our smart device, all these, the natural curvature we have is actually going forward. Whenever we got a phone for a long period of time or like leaning forward, so we're actually losing that integrity of the spine. So we, going more forward, again, losing that curvatures will increase the damage to the spine. So therefore, diminish the lifespans of the spine, more injury, more pain, more problems. So it will be good, since we understand that the best way is to have a good curvature for the neck, good curvature for the upper back, and good curvature for the lower back. So we have 3 very simple exercises that you can use every day, either with a chair or without chair sitting in place. Okay, so we'll go through some demonstrations right now. Okay, so when we stand in front of naturally, usually we want to see a person that stands with his ear right above the shoulders, or not like this, but more neutral. But most of the time when we're using computers or using cell phone, we're trying to do this. So all these exercises we're going to do is moving from this to this. Okay, so there will be 3 exercises you can do. The first one is the neck. So if we look at phones, we're kind of doing like this. So we wanted to do something that can reverse that process. So in order to do that, so you can take your both of them, you can follow along if you guys. Okay, put them behind your neck and lean back. So what you're trying to do is you're trying to see the ceiling as far as you can. Okay. So you do this about maybe 10 to 15 seconds. Then you're relaxed. Then you can do it again. Okay. So this is the way it's trying to. So you feel like you're super, super stiff when you're going backward. Hello. If you are super, super stiff when you're going through doing this, so that means your neck curvature is probably a bit less because you are experiencing a lot of resistance when you're doing this. Okay. So this movement is basically reverse the process of constantly moving down. So like this. Okay. So now we take care of our neck. Now what about our back? Most of the times when we sit down, especially we're working in front of the computer, we get really, really invested into what's going on in front of computers. So where your body starts leaning forward and forward. If you are a very tall person, when you're talking to someone, you tend to lean forward as well. So they are actually creating some unnecessary stress for the back. So for this one, again, your back is going this way. So you want to do something to reverse that. So this is a very simple exercise. You can do this at home, either sit down chair or standing, which is fine. So you put in both hands right on your hip regions, like that. Okay, so this is basically stabilizing hip. So because later on when we do the exercise, we want the hip to stay where it is. And you just try to like lean back. Okay, if you're feeling a lot of restrictions when you try to lean back, so again, that's an indication of you probably have some strains in the lower back. Some people, even this exercise will trigger some kind of like a shooting pain or numb tingling in the hand. So that means you probably have some like dizzy issues. But if you don't have these sensations or you don't feel rested, by doing this exercise, we're also try to reverse the process. Yeah, so far okay. So we take care of the neck, take care of the lower back. So one more thing is the chest. Again, when we lean you forward, the whole body is going this way. So you might look a very simple position, but what it does is actually shortening your chest muscles, bring your shoulder forward, and also creating this. So when we stand in front of the computer, usually we want to stand like this. So your thumb is, when it's relaxed position, is facing forward. But if you're doing this all the time, your thumb will slightly rotate because the shoulder girdle position will be a little different. So it's going this way. So you can do a self-check at home, look in the self mirror. Is your hand thumb forward or your thumb this way? So if it's this way, that means you have quite a hunching in the shoulder. So imagine constantly tending toward that tension. So again, this position, and we wanted to reverse that process. So how do we do that? This is quite simple. You can use a chair or use a hand. You just interlace your hand and hold back. So you can also hold on to the chair and lay back. So really straight. So for some people, this position is already very tense on the chest. So that means they probably already looking down quite a lot. So if you're doing like this way, okay. So to review the 3 exercises, we basically, all these simple exercises, we're trying to reverse this to this. So the neck one, the lean back, reverse that looking down, and your lower back one, you'll stabilize your hip, stabilize the hip, then leaning back, you're creating that low back curvatures. If you're feeling like quite strained, so maybe you're slouching too much at workplace. And the last one is basically open up the chest to release our tensions on the shoulder. Okay. So all these exercises you can do about 10 to 15 seconds per set. And do maybe repeat it 10 to 15 times. That will be one set. I'll repeat about 3 times throughout the day, especially if you're gonna sit in front of a computer for a long period of time. Okay. So very good. Okay. like we mentioned before, because the lifestyles we are having right now, we're losing that curvature. So if we can improve that curvature, you'll have a nice S shape for our spine. Then whenever there is, let's say, accidents or sports injuries or sitting in the awkward position, your spine become more resilient because it is going back to what is a natural position it's supposed to be, which is the ideal ergonomic of the neck and lower back. So this is basically the core of how to have a stronger spine. It's not necessarily about, yes, exercise, core stretching exercise is important, diet is important, rest is important. But if the framework, if the foundation of the body is off or not in the ideal position, all these things you're doing around may not achieve the 100% or 150% of the all these accessory things you're doing. So it's very important to take care of the core issues, the foundations, before you explore other options. Okay, so how does the chiropractic come into place to improve the curvatures, all these? Yes, when it comes to chiropractic adjustments, the adjustment actually find where the misalignments or imbalance in the spine. Because as we going on with the days, there are always could be injuries, small missteps, or awkward positions for the bodies, or causing like fixations in the joint. So the joint will not move properly. But a lot of times people might be just walking around not knowing there's an issue, but let it set, let it wait, and it's going to become bigger. So the chiropractic adjustment, what it does is improve the mobility of the joint, improve the mobility of the joint. So whenever you're going to exercise or strengthening exercise, the quality of exercise is better and it's more effective. So we have adjustment for the back, the chest region, and neck issues. Okay, so any questions for me at this point? Yeah, any questions? I guess that was super clear then. Okay, so for today, there's a few things I want to introduce you guys to. So, Gita is one of our working partners. They are doing the pillow and the back support, so that there's a lot of accessories you can use. So there's a $20 voucher for that. If you go and purchase anything, you can utilize that voucher for that. So under the back support is also coming from that. So later on you can take a look. They use latex, sustainable materials, so it's good for the environment. Yeah. We also have the 90A promotions for everyone. If you're watching online here, you can leave a message in the comment sections. So the 90A is including one consultation, one kind of adjustment, and also a 20 minutes massage, one ringing in your body. So again, like coming through how we want to treat from holistic adjustment, and also muscle work together, so that overall we improve the outcome for the patient. Okay. Yeah. All right. Thank you very much. If you got any questions, I'm here to answer for you.
No, I would like to sign up for it.
Yeah, sure. Ernie will help you. Yeah, Ernie will help you to sign up for it. No problem. Yeah. So you got some knee issues.
I have knee and back, upper body.
Sometimes with a knee, if it's just one side, right?
Both sides.
If it's both sides, right? Both sides, yeah, then there'll be some muscle issues involved, which is gait, and also the lower back. Usually, knee, we always look at the back first. If there's any problems in the pelvic region, you will definitely look at that. Yeah. Okay. Yeah, Hardy can help you. Yeah, great. Yeah. Hopefully that was helpful.
Yeah, I think it's helpful for her. She realized I'm both sides.
Oh, so you have some issues when you okay, so you sitting for long period of time?
Yes. My job is close. So instead I shift to a high table right now.
Oh,
I stay a long day.
Oh, okay. So you are doing the standing test right now?
I would say it's a collaboration space. So it's a it kind of is high bar table.
Oh, okay.
So I will just prefer to use that because it's a high chair as well. I can sit if I'm feeling tired. But
So high chair, where you put your feet then?
there is a rest.
Oh,
So it's still alright. It's just that because myself I have my gut issue, so
oh,
I
okay.
also try not to sit too long.
Yeah.
So hence that now I stand longer hours than I sit.
Yeah. So when you stand,
Yeah,
sometimes you shift your weight.
Yeah.
You feel like okay. So again, like you really want to making sure the pelvic region is balanced, core is good. Yeah. Any exercise you do after?
Yes, I lift weights.
Okay, cool. So good.
So it's very obvious that I can see that when I'm doing weights, right? My body tends to be into one way. I guess it's
okay.
because when I sit, I have unconsciously learned to cross my leg.
Oh,
So-
it's really bad.
Yes,
Don't cross
I
your
know.
leg.
Yes, and sometimes you will see that the leg will be like one longer than the other one.
Oh,
So
okay.
hence that it's very obvious because when you're doing weights, right?
You'll feel like one side
Yes.
pushing more, right? Okay. So imagine that if you're going through life, like one side pushing more, the one side of your body will have more wear and tear. So usually that's patients who experience like sports injury. It's like, I've been doing this all this time. It's like, why it happened? Well, it's probably the form, the mechanism wasn't really correct in the first place. But a lot of time we're just kind of going through, push through the pain, not knowing, like, yeah, maybe you should really get checked out. So that accumulated over into escalate into something much bigger. So yeah.
So hence that I now really remind myself, still try not to cross my leg.
Yeah.
And did a warm up
Yeah.
before and after my weights because I know how severe it will cause.
Yeah. Or if you are right now instead of going for the bar, if you feel there's a significant amount of compensation you're doing, maybe instead of the bar, you go with the free weights. At least the distribution is a little bit better, so you are not. The bar is the same, right? You can't really adjust. Yeah, exactly. Yeah, no problem. Yeah, we're here to help you. Yeah.
This is the year that I want to
Be better.
heal the body before I can do more.
Yeah, definitely. Yeah. No problem. Yeah, great. Nice to meet you.
Yeah, Alex, come. You guys wanna sign up?
Yep.
Not really sign up. Okay, as a new patient,
Yep.
what I can explain is we are having the promo for new patients. At 98, we will have one consultation, one chiro, thanks one kid,
Okay.
and then one 30 minutes sports massage, which will focus on the
revenge race. See ya.
Therapies will focus on that for the 30 minutes. That's all for 98.
Okay.
Yeah, so when you guys want to do?
Good day.
Today.
If you have, yeah.
Okay, for today, Dr. Jeff has the slots at 4, and you want to go with Dr. Jenny or you want to go with Dr. Jeff? Okay, take one each, and then, but you guys need to come back for the sports massage because I think if Diana take you now, you only one. Yeah.
I hurt my knee yesterday.
Or you wanna do because right now I can put you, but Alex gotta wait only 4 p.m. slots, and for Dr. Jenny she's available now. Is that okay?
Why not you go first and then I make another one?
Or you guys wanna? I don't know if you guys wanna come back tomorrow. Where both of you can do back to back together.
Tomorrow you go come.
Yeah. We have. If you guys wanna come back 12 noon. Alright, and then while you go and see Dr. Jenny, you go for a sports massage, and then after that you guys.
Okay, sounds good.
Is it good?
Tomorrow,
Rather than
Yep, sure.
Okay. Alex, I need your holding camera. Let me just check here.
With the pain lasts more than let's say 3 days,
like slow,
then
right?
you should
Yep.
really
Okay.
check that. You know, to see
So,
your doctor.
I'll set you guys at
Because
12 tomorrow.
If it's not
Sure.
minor issues, then you should be fine. But if it's not minor
So,
issues, you will escalate to something much better. So you can monitor about 48 hours, and if it doesn't get better, then you'll go and maybe see the hospital for that. Okay. Okay, so we have to answer questions, guys.
Okay, I'll send you guys the appointment confirmations again. So that will be 12 o'clock onwards. So
Sure.
you guys can be here like 10 minutes earlier because I need you guys to fill out the forms and everything.
Sure.
So all both treatments going to happen tomorrow.
Okay, thank you.
Okay?
Um,
Thank you, yeah.
I'm assuming we should not consume any food before that.
Ah,
It's
no
okay.
problem.
Yeah,
Can.
normal.
Shouldn't be a problem.
Yeah,
Yeah,
okay.
oh, okay.
Okay.
It'll be good. And then you give you the burp.
Okay, okay,
Okay?
Yeah.
okay.
Alright.
Thank you.
Okay.
Thanks, Dr. Jenny.
Yeah, no
Okay,
problem.
bye.
Have a good rest.
Thanks for coming
Thank
down.
you for coming down. Thank you. Bye.
Semua tak terjaga. Semua tak terjaga.
Yeah, yeah, this one.
So then you can see what is lah, ha?
So they're coming.
Yeah.
Can take it.
Huh?
Then I will finish up the light.
Uh-uh.
Okay, so we are finishing up the workshop in the clinic just now, and please let me know if you have any questions. I'm staying around to answer the questions. I think that there are still some patients around, so don't mind it. Were the chiro able to help with sinusitis and IV stroking for you? Okay, sinusitis. A few things you need to check before whether or not it's a chiropractic can fix problem. So number one, is anything related to your allergy? You know, is it certain environment you have the sinusitis, or can you trigger by something? So number one, is it allergy related? If it's not allergy related, or you also need to check whether it's your symptoms. Sometimes it's really the nose symptoms causing the problem. So you need to check the symptoms. If it's not because of the symptoms, then chiropractic adjustment can help because your facial bones is kind of like a jigsaw puzzle. And then in between your facial bones, there's a canals inside. And that's how like we drain or fluid out of the face, how we drain lymphatic, all these things. So that's how we do it. So making sure, you need to make sure that you should check. Number one is allergy, number two is symptom. If it is not allergy, not symptom related, then yes, you can explore chiropractic adjustment as a way to solving your sinusitis. Okay? Sinusitis can be a bit, if it gets worse, it can be a bit of problems. So why I say that is because the sinusitis, it got a fluid in the canal, right? So remember there is a, sinusitis basically is a drainage problem. So if you have like blocked sinuses, and that you will accumulate. So flu accumulate means bacteria love to grow in that environment. So when the bacteria start to growing in that environment, what's gonna do? Remember, we're talking about scalp here. So you will go into the meningeals, which is this blood vessels in your brain. And you cannot say that it'll be a brain infection, but it's definitely gonna affect the meningeals. So which is gonna be a much bigger problems, you know, fevers and all these. So better is to get checked out. Is it allergy related? Is it symptom related? What could be the possible cause for that? And try to solving that before you escalate into something much, much worse, such as meningeal related infection because of the bacteria that's accumulating in your sinus area. Okay. Any other questions you guys wanna put in? Okay, that answer the neat questions from Gabby. So I hope if you guys tune in the beginning of the workshop, thank you so much for tuning into the workshop. Okay. Any more questions? Okay. Thank you. I'll definitely, yeah. So you see first, the special planning. So any sort of injury, okay, so this is always a rule of thumb. If you have injuries, it can be either your elbow, your knee, or any kind of injury. If there is tremendous amount of pain, when an injury happens. Let's say if you're playing soccer, you try to kick. Someone coming to the opposite directions, land their knee or their on your knee. There's tremendous amount of pain in the area, and that is ER situation because you will never know. It could be he can fracture part of your kneecap or maybe the ligament is here. So that's a possible outcome. So whenever the pain is like 9 out of 10, go into ER right away. Okay, so no question about that. Number 2 is, okay, I kind of heard it. I still can walk around with it, but I'm not really sure, should I go to the hospital or not? Then you can do a little bit compressions because there's a lot of swelling, or you can ice it down. And you monitor that for the 48 hours. If the condition is gradually getting a little bit better, then you know it's probably just minor injuries. And our body is quite resilient. So when it comes to minor injuries, it can get better on its own. So just really give it time. Let's say it's minor injuries, you'll rest, you'll compress, you'll put ice in the area. It was okay. It was okay. It's just getting a little bit better. But you still feel nothing is quite right. Maybe it's affecting the way you walk, or you're having some pain when you're not using it. Then you have to go get a check. Sometimes a minor tear, minor like twisting or turning of the neck of the joints can cause that. So it could be another underlying issues you need to resolve. Thank you for liking the live. Yeah, please also share with somebody if you are watching. Okay. All right. Okay. Any more questions here to help you to answer? Okay. Okay. So the pita is also here. Just okay. Please. Any more questions you can ask? Okay. And okay, sinus issues. We talk about that. I hope you guys do get something out of the workshop, which we talked about briefly about the exercise to improve your spinal curvature. So exercise improve the spinal curvature for your neck, for your chest region, as well as for your lower back. So these are things you need to look out for. Okay? Any more questions? So hope you guys find value in this. Miss anything. How can we sign up for the workshop? Oh, okay.
No,
Yeah.
next week.
So we're doing a workshop every other week. So for the next one will be
Next Saturday.
Every other week. So
Oh, every other week will
yeah.
be 15.
15th will be the 15th. You can DM us, then leave your name and phone number will register. So if you want to come like a physical workshop, we have it in here. If you're watching somewhere else, you can also tune in during the live. But obviously the live will be a little bit later. But yeah, do follow us right here because we do have a lot of information on hand. You can go check it out. You can go follow us right here. Okay. Oh, someone from the restaurant. Okay. Yeah. So the workshops we host about, do you have an online tutorial? We don't because we are a chiropractic clinic. The treatment is very much hands-on. But if you want some free information here regarding our stretch, how to improve your spine mobilities, like if you have just minor issues you wanted to try to solve on your own, you can follow us right here. And we have a lot of information there you can go try to follow. Okay. So for the people who are attending the online, the physical workshop, which we just host right here, you will get a voucher from one of our working partner, which is Visa. So this is a voucher you will get if you're coming to a physical workshop. So you will have a $20 off voucher if you want to purchase anything from Visa. Visa is a pillow mattress company. They use latex material, 100% natural and really good for the environment. So if you come to the physical workshop, you will get the vouchers as a part of your, as a little benefit for your attending. So it's 20, and you can use this voucher to offset any purchase you want with them. Okay, so they do have a showroom in Ubi, and you can go check that out. And you can use the $20 voucher to offset either it's a pillow or something, pillow or back. In here, you can also try. So Kika gave us the back support pillow for us to try. So this one is also in latex. Actually, it's really soft. So I'm going to show you real quick. So if you come, you get to try it. So this is like a latex here. It's very soft right here. Don't need to wash. You can change, but don't need to wash. Do not wash later. And then it will come with a nano technology sheets cover. So this one you can wash, but the inside, because it's in latex, once you wash and oxidize, it gets super hard and crispy. I mean that's what you're not supposed to do. So it's right here. So if you want, you can come to our physical workshop and you can have the voucher with you, and you can purchase your own. Either it's a back support or a pillow or mattress front. Okay. Any more questions, you guys? Any more questions? You guys are not patient or finishing up. So. Okay, any more questions? You guys wanna? To more questions you guys wanted to ask? I'm here. I will help do my best to answer other questions. Okay, any more questions? You can shoot here, then I will try my best to answer for you. Thank you for joining in, Sufei. Thank you, Emma, for joining in. Thank you for that. So we are located at 116 Lavender Street, 0102. We're living around, the physical shop has been around for about 9 years. So the clinic has me and Dr. Jeff. We also have a massage therapist on site to help us. So we've been in the business for about a decade now. So 10 years plus experience to help you to improve patients' quality of life and also the communication. Thank you for liking the live. Shihan, thank you for liking the live. Okay. Any more questions? I'm here to answer your questions. One. Let's see if I can. Let's see. Yeah. Why is so bright? Good. Yeah. Any questions? You can try to answer here. Yeah. So tomorrow it will be 12 for.
12 for Alex see Dr. Jeff,
Mm.
and then Grace will see Diana at 12.
Oh, okay, okay. Oh, then I will
After
swap.
that,
Okay.
Grace, once Grace finish, will see you. Then
Okay.
Alex see Diana.
Oh, okay.
Like that lah.
So like they
Yeah.
don't need to come back
No
another
need-
time.
I mean, no need to wait that long.
Okay.
Because each time both will be inside. So
Ah,
there's
yeah.
no waiting.
Ah, yeah, yeah, yeah.
So
That
when
would be
they
good.
come out, the other one also,
Mm.
you know,
Okay.
it will be like that lah.
Yeah.
So Dr. Jeff know, he got one tomorrow.
It's okay. Just coming to work. Yeah. See, it's still going on.